Acid-reducing medications include antacids that directly lower the acidity of stomach contents, and anti-secretory medications that act on parietal cells in the stomach to decrease acid secretion. They are used to treat conditions like gastroesophageal reflux disorder and peptic ulcer disease by decreasing the acidity of the stomach and allowing the epithelial linings to heal. Now, the stomach is composed of 4 regions: the cardia, the fundus, the body, and the pyloric antrum. There's also a pyloric sphincter, or valve, at the end of the stomach, which closes while eating, keeping food inside for the stomach to digest. The epithelial layer of the stomach contains different gastric glands, which secrete a variety of substances. Starting with the cardia, it contains mostly foveolar cells that secrete a protective mucus, which is mostly made up of water and glycoproteins. The fundus and the body contain both the parietal cells and enterochromaffin-like cells, and the antrum and pyloric areas contain G cells. Now, gastric acid is mainly composed of HCl, or hydrochloric acid, which is mainly secreted by parietal cells. Parietal cells have M3, CCK2, and H2 membrane receptors, which modulate their secretory behavior. When food enters the stomach, it causes the stomach walls to expand, which leads to the activation of these receptors. First, stomach expansion causes the branches of the vagus nerve that innervate the stomach to release acetylcholine, which activates M3 receptors. Next, the G cell in the antrum of the stomach release gastrin, which activates the CCK2 receptors. Gastrin and acetylcholine activate the enterochromaffin-like cells, which release histamine, and that activates H2 receptors. Activation of M3, CCK2, and H2 receptors increase the conversion of H2O and CO2 to hydrogen ions in bicarbonate, bicarbonic anhydrase. The hydrogen ion is then pumped out of the cell and into the stomach via the hydrogen-potassium ATPase pump. These hydrogen ions combine with chlorine ions to form hydrochloric acid and decrease the pH of the stomach. Normally, the stomach is protected from the acidic environment by the mucus secreted by the foveolar cells. However, if there's an imbalance between mucus and acid secretion, like in Zollinger-Ellison syndrome, which is caused by a gastrin-secreting tumor, it could lead to damage of the stomach. This could manifest as chronic gastritis and gastric or peptic ulcers. Now, in the esophagus, the lower esophageal sphincter prevents most of the gastric acid from coming back up when the stomach is full or when you're laying down. If this sphincter is loose, the acid could reflux into the lower esophagus and erode the esophageal lining. This is called GERD, or gastroesophageal reflux disease, most commonly known as heartburn. One way to mitigate the harmful effects of gastrin in these disorders is to decrease the acidity through medications. Let's start with the H2 receptor antagonists, like cimetidine, ranitidine, and famotidine. These medications competitively inhibit H2 receptors, meaning that they bind to these receptors so histamine can't. These drugs are able to decrease nighttime and food-stimulated acid secretion by over 90%. They generally take effect within an hour of ingestion and last for around 12 hours, so they're perfect for taking before bedtime. These medications are generally given orally, but intramuscular and IV formulations are available. Now, cimetidine is a strong inhibitor of cytochrome P450 enzymes in the liver. These enzymes are responsible for the metabolism of a variety of drugs and toxins in our body. So if taken with other medications, like benzodiazepines or warfarin, cimetidine could reduce the rate of elimination of these other drugs and cause them to build up in the body. Cimetidine also has anti-androgenic effects and could cause gynecomastia, sexual dysfunctions like decreased libido, and loss of hair, or alopecia. Since it crosses the blood-brain barrier, it could also cause confusion and dizziness. Next, we have proton pump inhibitors, or PPIs, which include oral medications like omeprazole, lansoprazole, dexlansoprazole, and medications available in IV, like pantoprazole and esomeprazole. The oral forms of these medications are absorbed in the small intestine in their active form and get metabolized in the liver. Next, they travel through the blood to the parietal cells, where the acidic environment helps protonate them so they become fully active. These activated PPIs irreversibly bind and inhibit the hydrogen-potassium ATPase, or proton pumps, found within the parietal cells. Since the proton pump is the terminal step in acid secretion, Proton pump inhibitors are better at inhibiting acid secretion than H2 histamine receptor antagonists, with a decrease of up to 99% of gastric acid secretions. Because of this, they are more useful for the treatment of Zollinger-Ellison syndrome, which is caused by excess gastrin. Furthermore, they have a weak antibacterial effect against the peptic ulcer-causing Helicobacter pylori, so they are used in combination with antibiotics like amoxicillin, clarithromycin, or metronidazole. It takes 3 to 4 days for proton pump inhibitors to decrease stomach acidity, and they remain effective for 2 to 3 days. With continual daily dosages, an increased antisecretory effect can be achieved for up to 5 days. Side effects of proton pump inhibitors are uncommon, but can include headache, diarrhea, and rashes. When the gastric juices are less acidic, it also allows for more ingested pathogens, like Clostridium difficile, to survive and invade the GI tract. Finally, this change in pH also decreases the absorption of vitamin B12, or cobalamin, calcium, and magnesium. It could also reduce the absorption of certain medications, like digoxin and ketoconazole. Finally, we have the antacids, which are weak bases like aluminum hydroxide and magnesium hydroxide. These two medications are not well absorbed in the GI tract, so once they get to the stomach, they can neutralize some of the acidity by binding to hydrogen ions. In general, they're less effective in lowering the pH of gastric acid when compared to H2 receptor antagonists and PPIs, and are mainly used for symptomatic relief in GERD. For side effects, aluminum hydroxide inhibits smooth muscle contraction in the GI tract, leading to constipation. Long-term use has also been associated with osteoporosis. Magnesium hydroxide, on the other hand, works as a laxative by drawing water from the surrounding tissue, leading to diarrhea. In rare cases, this could also lead to hypotension. Now, we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all these farm facts. The H2 receptor antagonists that end in tidine will be represented by a fancy man with a black bow tie carrying his dinner under a plate cover. When he opens it, there's a live snake going hiss for histamine. He's got blocks of cement on his feet to represent cimetidine, and he's crushing a poor chrome-colored cell to help you remember the cytochrome P450 inhibition. Cimetidine also has anti-androgenic side effects, so let's have him crush a male symbol under his foot. Next up are the proton pump inhibitors, so let's have a gas pump where the hose is tied into a pretzel shape, since these drugs end in prazole, like omeprazole and esomeprazole. Waiting to refuel is a zeppelin for Zollinger-Ellison syndrome, and a helicopter piloted by a bacteria for Helicobacter pylori. For side effects, let's put a dusty closet full of bacteria for Clostridium difficile infection next to the gas pump. On the ground next to it are things that do not get absorbed by the GI, so we have a bottle of milk for calcium, some half-eaten cobbler for cobalamin, and a magnet for magnesium. Speaking of magnets, let's look at the antacids. Let's have a metal outhouse for these drugs since they both contain metal. Now, magnesium hydroxide is a laxative, so let's put a giant magnet on top of the toilet in the outhouse. Aluminum hydroxide, on the other hand, causes constipation, so let's have a roll of aluminum foil outside. For osteoporosis, someone even made a bone out of the aluminum foil, but it's not as strong as a real bone. Alright, as a quick recap, antacids are weak bases that neutralize the acids in the stomach. Antisecretory medications like H2 receptor antagonists and proton pump inhibitors act on the parietal cells to decrease hydrogen ion secretion. All three types of medication reduce the acidity in the stomach, which help treat or relieve the symptoms of peptic and gastric ulcers, gastritis, and GERD. But wait, there's more. Here's a mind map with all the mnemonics from the video. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers at the end.